since we're primarily a women's health clinic and focusing a lot on fertility, I think when patients are working on fertility and they're focused on getting pregnant, the next phase, it's like you don't realize all the different phases, right? So they're pregnant, they're kind of, really cautious in the first trimester as far as what they're able to do. And then as soon as they pass the first trimester and get into the second trimester, they're like, okay, what can I do now? So chiropractic care is like at the top of my list. Like, okay, you got to get ahead of it because we want to make sure that you have a smooth labor delivery and fourth trimester and postpartum recovery. It's so important.
Yeah, it's all very interconnected. Like the things that you do in the first trimester will influence the second trimester, will influence the postpartum rehabilitation. So I feel like that's one of the biggest things that I would love people to know is that the sooner you can have work done on your body as it's growing and evolving and the physiology is changing, the better your outcomes are going to be. Because if we can find and address something, at week 10, and as opposed to at week 35 where baby's much bigger taking up a lot of
Right.
space, there's just so much that can be done so early on that can influence the outcomes later on, and so I think that's a big like misnomer.
I think that's a really good point. The sooner the better. And, I think I ask you about timing all the time, but now you've educated all of us. So we are aware
Yeah.
to refer patients earlier.